Hello, my name is Megan Finnegan. My presentation is titled Motivational Interviewing in Schizophrenia Antipsychotic Adherence. As I have discussed throughout this course, non-adherence is highly prevalent in those with schizophrenia and leads to poorer functional outcomes. Consequences of non-adherence include relapse of illness, readmission to hospitals, higher use of psychiatric ER services, increased substance use, poorer life satisfaction, and also suicide attempts. In addition, antipsychotic non-adherence in schizophrenia leads to increased healthcare expenditures. Non-adherence not only affects consumers, but also healthcare providers as well, including advanced practice nurses. Non-adherence creates difficulty in providing quality, effective healthcare. The purpose of this project is to implement an evidence-based intervention, motivational interviewing sessions, to evaluate its effect on adherence to antipsychotic medications in individuals with schizophrenia. MI, defined by Miller and Rolanek, is a collaborative, person-centered form of guiding to elicit and strengthen motivation for change. MI is used to increase patients' awareness of potential problems caused by their behavior, the consequences experienced from it, and also the risks faced as a result. The specific target population for this project is adult individuals whom are enrolled in a program for Assertive Community Treatment Team, also known as PACT. These individuals have a DSM-5 diagnosis of schizophrenia and are prescribed an antipsychotic medication. The population was selected as it is easily accessible in the community and includes a large population of individuals who meet inclusion criteria. Additionally, this population has challenges with adherence, and the intervention is consistent with the PACT team's aim to improve patients' illness self-management and treatment adherence. A literature search was completed to establish a scientific foundation for development of interventions to promote medication adherence and guide clinical practice in individuals with schizophrenia on antipsychotic medications. 4 randomized controlled trials and 1 quasi-experimental study were evaluated. Additionally, clinical guidelines from the American Psychological Associations and UpToDate database were reviewed. Clinical guidelines from UpToDate and APA supported the use of MI in practice. In addition, 5 studies examined were successful in utilizing MI to improve at least one patient outcome in individuals with schizophrenia. 4 out of 5 were shown to improve adherence. Research showed that MI was successful in increasing adherence outcomes, including improvements into insight, medication adherence, symptom severity, number of rehospitalizations, as well as attitudes towards and satisfaction with medication compared to the treatment as usual groups. Implementation of this intervention would start with a meeting with key stakeholders. After approval is obtained from stakeholders, those who meet inclusion criteria would be called and read a telephone script to see if they would be willing to participate. From there, participants would sign an informed consent. The next step would be for participants to complete baseline assessments, which include the Insight and Treatment Attitudes Questionnaire, the Drug Attitude Inventory, and the Moresky Medication Adherence Scale. The Insight into Treatment and Attitudes Questionnaire has scores between 0 and 2, with higher being the most insight. The Drug Attitude Inventory scores between 0 and 10, with higher scores indicating more belief in the personal benefit of medication. Finally, the Moresky Medication Adherence Scale scores from 0 to 8, with scores of 8 reflecting high adherence, scores from 6 to 7 reflecting medium adherence, and scores less than 6 reflecting low adherence. These three measurement tools demonstrated reliability and validity in research. From there, the intervention, which is 8 one-hour weekly MI sessions from a trained practitioner, will be conducted. Sessions will include adherence-based MI discussions and assignments. Upon conclusion of the MI sessions, a post-assessment including the Drug Attitude Inventory, Insight Treatment Attitudes Questionnaire, and the Moresky Medication Adherence Scale will be administered again. This will also be repeated 6 months post-intervention for follow-up. Upon completion of the intervention and the assessments, data will be synthesized, compared, and evaluated. The outcome, which is medication adherence, will be measured based on these tools. It is hypothesized that improvements will be seen in medication adherence following the MI sessions. In conclusion, research has routinely found that improved medication adherence is associated with reduced healthcare use and costs. Adherence can reduce symptomology, hospitalizations, and improve functioning. Multiple strategies are necessary to ensure the best possible patient outcomes. Research has shown the use of MI as beneficial to healthcare, as it is a tool that can improve adherence to medication and is relatively easy to implement.